Migraine prophylaxis in a patient with a history of hypertension requires careful consideration, as some migraine prophylactic medications can affect blood pressure. It's essential to balance the need for migraine management with the potential impact on blood pressure control. Here are some pharmacological options for migraine prophylaxis in a patient with hypertension, along with their mechanisms of action, common side effects, and contraindications. 1. Beta blockers. Mechanism of action: beta blockers like propranolol, metoprolol, and timolol work by blocking beta-adrenergic receptors, which can reduce the excitability of the nervous system and decrease blood pressure. Propranolol is often the preferred choice for migraine prophylaxis. Common side effects: fatigue, dizziness, bradycardia, slow heart rate, and potential exacerbation of asthma. Contraindications: absolute contraindications include heart block, severe heart failure, and severe bronchial asthma. They should be used cautiously in patients with existing bradycardia or hypotension. 2. Calcium channel blockers. Mechanism of action: calcium channel blockers such as verapamil block calcium channels, leading to vasodilation and reduced blood pressure. Verapamil is commonly used for migraine prophylaxis. Common side effects: constipation, ankle swelling, dizziness, and bradycardia. Contraindications: contraindicated in patients with severe heart failure, significant conduction abnormalities, or a history of severe constipation. 3. Angiotensin II receptor blockers, ARBs. Mechanism of action: ARBs like candesartan may be used in migraine prophylaxis as they can help regulate blood pressure and prevent vascular changes associated with migraines. Common side effects: hypotension, dizziness, fatigue. Contraindications: generally safe in patients with hypertension but should be used cautiously in individuals with severe renal impairment. 4. Anticonvulsants. Mechanism of action: some anticonvulsants like topiramate and valproic acid are effective in migraine prophylaxis. Their exact mechanisms in migraine prevention are not fully understood. Common side effects: dizziness, somnolence, sleepiness, cognitive changes, and weight loss. Topiramate. Contraindications: contraindicated in patients with a history of significant hepatic disease, valproic acid, or kidney stones. Topiramate. 5. Triptans, in specific cases. Mechanism of action: triptans are usually used for acute migraine relief. However, in some cases, a low dose of furvatriptan or naratriptan may be considered for menstrual migraine prevention. Common side effects: chest tightness, tingling, and warm sensations. Contraindications: contraindicated in patients with uncontrolled hypertension. Monitoring for potential blood pressure changes is essential when initiating any of these medications in a patient with hypertension. Blood pressure should be monitored regularly during the treatment period. Additionally, lifestyle modifications such as stress reduction, dietary changes, e.g., low-sodium diet, and regular exercise should be encouraged to help manage both hypertension and migraines. The choice of medication should be individualized based on the patient's specific medical history and preferences, and it's crucial to involve a healthcare provider in the decision-making process to ensure the best possible outcome for the patient. Thank you.